Hello and welcome to Vet Resources Check-in. Today's topic is firearm suicide prevention and other lethal means safety. My name is Amy Johnson. I'm a licensed clinical social worker and I work for the National Suicide Prevention Program at VA. I've worked for many years with veterans in crisis as well as their families, and I've worked with kids. My goal here today is to encourage you to practice safe firearm storage within your home and to know when to consider outreaching for help when you need to store outside the home, especially when somebody is at increased suicide risk. There's also other lethal means that someone could use in a suicidal crisis that we will discuss. Remember, the most important thing that you can do today is go home and practice safe firearm and lethal means storage in your home. A little bit about me. I'm the granddaughter of a Holocaust survivor. Our family was liberated and saved by some American service members many years ago. I've always had a deep-rooted desire to serve veterans because of that experience. It is my belief that nobody wants to die by suicide. People want their pain to end. Many of us have been impacted by losing someone to suicide. Myself, I was impacted as a teenager when a good friend died by firearm suicide. I know that she didn't want to die. She wanted the pain that she was going through to end. I know her family, if they could have stored their firearm differently, feel that they could have also helped to save her life. It's really important that we consider steps that we can all take to prevent suicide. You don't have to be a professional in order to do that. So let's get into some more of the details. The connection between firearms and suicide is significant. In the United States, the majority of firearm deaths are suicides. In 2019, there were 39,707 firearm-related deaths in the United States. That's about 109 people dying from a firearm-related injury each day. 6 out of every 10 deaths were firearm suicides, and more than 3 out of every 10 were homicides. What that means is there are more suicides in the United States by firearm than there are homicide. The majority of veteran suicides, as well as veterans who receive care from VA and those who don't, are also by firearm. We recently released our 2021 National VA Suicide Prevention Annual Report, which is available at mentalhealth.va.gov for more details. With nearly 70% of veteran suicides being by firearm and approximately 1/3 of veterans storing their firearms loaded and unlocked, according to research, we know that increasing time and space between individuals facing a suicidal crisis and a firearm can prevent suicide. We can save lives. Firearms were more often involved in veteran suicides in 2019 than in 2018. The percent of suicides that involved firearms was greater among veteran men and women than among non-veteran or civilian men and women. So what can we do about it? We can practice lethal means safety. This is a term that we use within the medical and mental health field to talk about the intentional, voluntary practice to reduce access for someone at suicide risk by decreasing quick access to potentially lethal means like a firearm. Promoting lethal means safety is an evidence-based component of a comprehensive suicide prevention strategy that we at VA have a mission to follow. We need your help. We need your help to practice lethal means safety and to spread the word to your family and friends. Firearm storage matters because 90% of people who survive a suicide attempt do not go on to die by suicide. The problem with firearms, especially with people who know how to use firearms, is that the majority of them end someone's life when they're used in a suicide attempt. Again, we know that we can save lives because if someone can survive a suicide attempt and suicidal crisis, there's a really good chance that their life has been saved. The time between when a person dies by suicide and the time that they think about the suicidal behavior is short. A 2005 study found that 71%, the majority of attempters engaged in suicidal behavior, said that the process from time of thought to time of action was less than an hour. This reality underscores the importance of reducing access to potentially lethal means for people at increased suicide risk. While some suicidal crises last long, again, most of them last minutes to an hour. We know that almost half of all American veterans own a firearm, and that there have been increased firearm sales in the last few years. That is why we need your help to consider ways to practice safe and secure firearm storage. Some examples of that would be making sure that firearms are unloaded, locked, and secured when they are not in use, with ammunition stored separately. We also encourage veterans and their family members, caregivers, and children to take simple steps to protect themselves and their family, particularly if they or others in the household are at increased risk for having thoughts of suicide, depression, substance use. That includes increase of alcohol use, opioids, marijuana, or any other mind-altering substance. This can help promote safety. Let me give you an example. If a child of a veteran starts to help them with their medical appointments and notices that they've been having changes in how they think and their memory, it would be really important for that child to go ahead and talk to the veteran about where their firearms are and to encourage the practice of secure storage. Another example, during the pandemic, many of us have had young children at home. Many of us have also had other family members stay with us because of the situation that they found themselves in. It's vital that someone consider who owns the firearm, that they practice safe and secure storage with increased access among young children and people who are visiting the home. Federal firearm licensees are business owners in your community who can also help. There are firearm retailers or range owners who may offer temporary secure storage of firearms outside the home. If you choose to pursue that, you would need to make sure that that is in accordance with your state and local firearm laws. Temporarily storing firearms outside the home, especially when there's been a health crisis, there's been an emotional crisis, there's been a recent suicide attempt, or a recent psychiatric hospitalization, could save lives. We know that when someone owns firearms, their risk of suicide is higher than those who don't. Research does indicate that lethal means education, like what we're doing today, and learning more about how to store additional items like medication and other potentially lethal means like alcohol, opioids, or other substances is supported by many service members and veterans. So if we pause for a moment and you think about your own home environment, what are some things that you could do? Could you start to consider a safety check on a regular basis? If you do a safety check on your home, and encourage your friends and families to do that as well, first start with, where are any firearms stored? Are they stored securely? Where is the ammunition? And could you benefit from a cable lock on the firearm? Having multiple steps to access a firearm for someone who's experiencing thoughts of suicide can also slow down the thought to act on those thoughts and can encourage them to have more time to reach out for help. At the VA, we provide free cable gun locks to veterans and their family members. By visiting veteranscrisisline.net and looking at local resources, you can search by your zip code to find the nearest VA, as well as the nearest VA suicide prevention coordinator. You can request cable gun locks. We do not keep information about who owns firearms, and we are not interested in storing the firearms at VA. What we are interested in is partnering with you to encourage safe and secure storage of firearms. Cable locks have been shown to help many people in suicidal crises. A recent example was a mother of a young veteran who reached out to someone they knew worked in mental health, explained that they were concerned about the risk factors the person was showing and thought they might be at increased risk for suicide. The person who works in mental health gave them some cable locks and encouraged them to put them on the firearms in their environment. A few days later, that mother found her son with a firearm and the cable lock on it. When she asked him how he was doing, he was emotionally upset and said that the cable lock stopped him from using the firearm in a suicide attempt. We have had stories after stories of veterans who call us on the Veterans Crisis Line or come in for VA care and tell us that they stopped themselves or reached out for help because their access to that potentially lethal item was limited by a cable lock, a sticker, a picture of a family member, or some other visual reminder that help is available. Medication is also something that could be potentially dangerous if someone is having thoughts of suicide. When you're doing your home safety check, consider, could you store medication more securely in your home? What about a lockbox? Do you have old medication that could be more safely recycled at your nearest VA or community pharmacy? Do you have someone in the home who's struggling with substance use, alcohol, opioids, marijuana, or anything else? Are those items stored securely, and could that person benefit from getting help? VA can help. The same resource locator on the veteranscrisisline.net website is available to help find treatment. Remember that prescription pain medicine, or as I referenced, opioids, can be potentially dangerous. Any other medication that's potentially sedating should also be secured in your home. And if you no longer need that medication, make sure that it's recycled appropriately through a pharmacy at VA or in the community. If someone has talked about hurting themselves or recently told you that they attempted to hurt themselves, take it seriously. Encourage that person to get help. If they are a young teen, ask for help in your community from trusted people that you can reach out to. You can also use the same resource locator to find community resources if it's someone who's young or not a veteran. If the person is a veteran, encourage them to get help, validate their feelings, and let them know that you can make sure that they can talk to someone either by calling the Veterans Crisis Line at 1-800-273-8255 and press 1, by searching for local treatment options on one of our treatment locators, or by actually going to the VA. Please remember that it's very important that you do a home safety check, and you encourage all of your family members and friends to do the same. We have more information available about the life-saving techniques of securely storing firearms and other lethal means at keepitsecure.net. That is www.keepitsecure.net. Some of the things that we've discussed today are ways that you can reach out for help from a VA provider, including a VA suicide prevention coordinator, considering a home safety check in your own environment, assuring that your firearms are stored securely with locking devices and unloaded, especially when somebody in the home has had emotional crises, thoughts of suicide, or a recent psychiatric hospitalization. We have more resources available at mentalhealth.va.gov. Thank you for watching today's episode on firearm suicide prevention and other lethal means safety.